In the U.S., the White House says the worst days of the COVID-19 pandemic are still ahead. A special committee is set to approve a vaccine on Thursday. First responders and residents in long-term care homes are the first priority. The general public could start getting the shots in the spring. As Jennifer Johnson reports, the vaccine can't come soon enough to stop the latest surge in deaths and hospitalizations.
Federal health officials are calling on Americans to stay vigilant as they race to roll out a COVID-19 vaccine.
We're going to focus on those most vulnerable and those most on the front lines of treating people with COVID with the initial 40 million doses in the next month.
A Food and Drug Administration advisory group will vote Thursday to give emergency use authorization for the Pfizer vaccine. If approved, millions of doses will then be fast-tracked to each state.
Within, I would say, 36 hours from approval, potentially the first immunization could be taking place.
Officials say general population vaccinations could begin by April in a race to stop a virus that's killing about 2,000 Americans a day.
The vaccine's critical, but it's not going to save us from this current surge. Only we can save us from this current surge.
Dr. Birx and others are frustrated so many Americans still refuse to physically distance or wear masks and calling out state leaders for not doing enough.
We have governors and mayors who have cases equivalent to what they had in the summertime, yet aren't putting in the same policies and mitigations that they put in the summer.
Some governors are making unpopular decisions. Starting Sunday night in California, a stricter, more widespread stay-at-home order goes into effect as ICU beds become scarce.
People's jobs, their businesses, their livelihoods are at stake. This is going to be painful.
I think this is going to be the nail in the coffin of a lot of restaurants here in San Francisco.
Trump administration doctors plan to brief the Biden transition team this week after the president-elect questioned whether there was a plan to properly administer the vaccines, since some require ultra-cold refrigeration. Jennifer Johnson, Global News, Washington.